today I'll be talking about lifestyle and dietary management of raised sugar. This would be applicable to patients who are pre-diabetic, at risk of sugar, or who are diabetic as well. There is good evidence that lifestyle modification can help with this. The goal would be that you receive some basic information here, and if you wish to supplement that with more tailored advice, you could of course seek the help of a dietitian for that. Weight loss has been shown to benefit by reducing insulin resistance, but also reducing the amount of sugar produced by the liver, and by leading to a more favorable cholesterol profile. We should encourage patients to eat more fiber, choose foods which are lower in fat, and I have done separate blogs on obesity, diets, cholesterol, etc. So I'd urge you to check out my other blogs on these topics. Choose low fat items, choose more fish and lean meats. Consider how they cook their food, so choose more healthy methods of cooking. Choose more healthy snacks. Even a 5 to 10% reduction in weight has been shown to reduce cardiovascular disease risk, as well as parameters around sugar, cholesterol. Of course, if you lose more weight, 10 to 15%, then you get even more benefit, and I have discussed weight loss in a separate blog. There is benefit to fatty liver as well. The American Diabetes Association found that the use of non-nutritive sweeteners, so these are certain types of sweeteners which do not get absorbed into your body, they just get removed, they do have the potential to reduce overall calorie intake and overall carbohydrate intake. So when you talk about diet, generally you're aiming to reduce fat, reduce trans fats. And so the type of diets you'll be considering would be a Mediterranean diet, a plant-based diet, or a DASH diet. The Mediterranean diet has been shown in trials to reduce sugar, and you can find more details of the study in my blog. Of course, fish, avocados, fresh vegetables, these are main part of a Mediterranean diet. A vegan diet has also been shown to have a positive effect in sugar levels. And here I'd like to add that plant sterols and stanols, when used as fortification to replace butter, have been shown to reduce cholesterol. And here in Canada, we have a product called Bessel Proactive, which contains that. In the UK, there was a product called Benecol. A DASH diet, which is primarily for blood pressure, also helps with sugar control. And the principles are fairly the same. Encouraging more whole foods, whole grains, less processed food. I'm talking about 3 items which are in research. One is transpalmulates. These are products of naturally occurring dairy, and there has been one study which seemed to suggest a reduction in metabolic risk when transpalmulates were in the diet by reducing insulin resistance. This needs to be further explored. There's also something called isoflavonoids, which is naturally found in soybean products, legumes, seeds, lentils, beans, peas, and certain types of foods like pasta can also be enriched with isoflavonoids. These appear to be having a favorable effect on cardiovascular disease risk in patients with diabetes. And thirdly, this is something you want to avoid. Advanced glycation end products are primarily derived from high temperature cooking, like deep frying and tobacco products, cigarettes, for example. And these have been shown to worsen the situation with insulin resistance, immunity, and there is some evidence that these are not beneficial.